In 2008, nearly 15% of households in the United States were food insecure. That meant millions of families lacked consistent access to enough food for an active, healthy life. To address this, the federal government uses programs like the Supplemental Nutrition Assistance Program, or SNAP. Notice the structure of this aid. It operates on a direct-to-consumer model. The government calculates eligibility and transfers monetary value directly to the family unit. The Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, works the exact same way. The authorized items are listed right on the individual's voucher, proving that the subsidy bypasses third-party institutions entirely and goes straight to the parent. This direct-to-family architecture is economically efficient. The aid scales perfectly with the family's poverty level, regardless of where they live or whether the parents are employed. In standard federal policy, poverty alone is the necessary and sufficient trigger for a hungry child to receive food aid. But there is a massive $2.4 billion exception to this rule, the Child and Adult Care Food Program, or CACFP. Unlike SNAP or WIC, the federal government does not give CACFP funds to parents. Instead, the subsidy is intercepted by the child care provider, who is reimbursed for the meals they serve. Because of this structure, the vast majority of poor 2-year-olds are entirely excluded from receiving this federal money. To understand exactly how the system fails these children, we can look at data from the Early Childhood Longitudinal Study, which tracks a nationally representative sample of children born in 2001. This data allows us to trace the specific institutional filters: a child's age, the type of care they receive, the provider's licensure status, and their profit incentives that block the money from reaching the child. Under CACFP, a low-income child's receipt of federal nutritional aid is dictated entirely by institutional mechanics, not their actual nutritional need. The very first filter separating a poor child from the food subsidy is their care setting. This flow diagram shows the total cohort of all 2-year-olds in the United States. Immediately, 61% of these children are routed out of the program. They are in exclusive maternal care, making them entirely ineligible for CACFP. Another 20% are placed in unlicensed care, typically looked after by neighbors or relatives. Federal rules disqualify these settings as well. By the time we account for those two groups, only a tiny sliver of 2-year-olds make it into licensed, eligible care settings. Statistically, the poorest parents are the most likely to use informal or maternal care. Because the program's strict eligibility rules mandate formal care, they systematically filter out the exact demographic the program is intended to feed. When we advance the timeline to the 4-year-old cohort, childcare realities shift. This new diagram shows that maternal and unlicensed care drops significantly. Center-based care, including nonprofit centers, for-profit centers, and Head Start, become the dominant environments. Head Start provides a clear success story here. Participation in the CACFP among Head Start centers is near universal, sitting at 94%. But outside of that isolated network, things fall apart. Among standard for-profit and nonprofit centers, despite being perfectly eligible for the money, participation rates remain wildly inconsistent. Once a poor child finally enters an eligible daycare center, a new barrier emerges. We have to ask what prevents the center itself from claiming the federal food money. Participating in CACFP places significant fixed administrative costs on a business. Providers have to plan specific menus, track daily attendance, and undergo sponsor reviews. To offset these fixed costs, providers must optimize their revenue using this federal reimbursement matrix, which assigns either paid, reduced, or full tier payouts based on each enrolled child's family income. The financial multiplier for low-income children is massive. Center reimbursements scale linearly, resulting in an 8-to-1 payout ratio for poor kids compared to non-poor kids. For a large center serving a low-income population, that can generate up to $14,000 in monthly payouts. For a center located in a densely poor neighborhood, the high volume of full-tier children makes dealing with the federal bureaucracy highly lucrative. But centers operating in mixed-income or wealthy areas lack that demographic density. With too few poor children to trigger the high reimbursement rates, the payouts simply fail to cover the administrative overhead. For-profit centers face an additional legal hurdle. They are barred from participating entirely unless at least 25% of their enrolled children are classified as low income. The result is a highly localized market failure. A low-income child living in a wealthy zip code is statistically stranded, denied federal food aid strictly because their provider cannot monetize their presence. Despite these massive institutional filters, we need to look at what actually happens to the specific poor children who do make it into participating centers. A regression analysis of 4-year-olds published by the National Bureau of Economic Research isolates exactly that outcome. To ensure scientific rigor, researchers controlled for selection bias to prove the center improved health rather than just admitting healthier kids. They adjusted for family covariates, center characteristics, and lagged age 2 outcomes, factoring in prior BMI and food security. The findings are highly positive. This plot shows that CACFP participation drives an 8 percentage point increase in daily milk and vegetable consumption. The data also shows a significant reduction in the probability of a participating child being underweight. However, the program has strict limitations. It does not reduce a child's probability of being overweight, nor cure baseline household food insecurity. This leaves us with an efficacy paradox. CACFP is a demonstrably effective nutritional intervention that is trapped inside a structurally crippled delivery mechanism. If the sole goal is child nutrition, directly expanding SNAP or issuing direct cash subsidies is mathematically vastly more efficient. But the current CACFP design serves a hidden secondary function. Because it strictly requires licensure, it acts as a backdoor federal subsidy designed to incentivize and sustain regulated institutional childcare environments. We are using a food program to subsidize the childcare industry, and we are doing it at the direct expense of feeding children in informal care. Until policymakers explicitly decide whether they are funding child nutrition or institutional daycares, the program will continue to selectively exclude the most vulnerable children, based solely on the economic calculation